Hey guys, this is Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know.
Now let's look at the shock and its management. So this shock management is nothing but it is an emergency. And so the first step will be always the CAB. So what is CAB? C stands for the circulation, A stands for the airway, and B stands for the breathing. Next is,
In case you haven't subscribed, please do subscribe and grow daily.
so this fluid replacement is required for almost every type of shock. So almost all types of shock. It is the most important in case of the than the inotropic drugs. So it is more important than the inotropic drugs. The fluid requirement is judged by the CVP, and in case the CVP is less than that of the 5 mmHg. So if it is less than 5 mmHg, we need to replace the fluids. So we replace the fluids. So mostly we give the crystalloid fluids. So the crystalloid fluids are what is administered. So these include the ringalactate. So ringalactate and also the normal saline. So if lot of fluid has been lost, so in case lot of fluid is lost, so we can give the blood transfusion. So we give blood transfusion also. Next, moving on, we look at the vasopressor drugs. So vasopressor drugs, these drugs are include in case of septic shock, there is the noradrenaline. So we check whether the noradrenaline NA is working or not by checking the MAP. MAP, as we know, it is a mean arterial pressure. So if there is a risk in case of the arrhythmias, the drug given will be the phenylephrine. So phenylephrine is given, and it is alternative is the dopamine. So dopamine can also be administered. Next, moving on to the cardiogenic shock. So here it will be the noradrenaline, which is of a greater preference than of the dopamine. So before giving vasopressors, the adequate fluid replacement will be required. Next, looking at the specific treatment in case of shock. So the specific treatment, it includes first we look at the hypovolemic shock. So in terms of hypovolemic shock, this includes the blood transfusion since there is loss of the volume. And next will be the septic shock. Septic shock, it is nothing but the BSA, that is a broad spectrum, AB, that is the antibiotics. Then looking at the anaphylactic shock, what is administered is A for A, that is anaphylactic shock, is for the adrenaline. So what will be the route? The route will be always, the route here is IM, and the ratio will be 1:1000. So it is 1:1000 ratio. Then moving ahead, the hypoadrenal shock. So what about the hypoadrenal shock? The hypoadrenal shock is nothing but it includes the steroids. Next, moving on to the secondary shock. The secondary shock, there is a beta blockers. So secondary shock involves the beta blockers, and they result in the vasodilation.
Thanks for watching. So in case you haven't subscribed, please do subscribe to learn and grow daily. And this is a special thank you note to all the subscribers of this channel. And we have a 30+ playlist subject wise, and it is in the description.